Why psychology?
It's a good question. I thought this was very easy to answer, but it's actually probably a little bit difficult because for me, it wasn't based on originally helping people. I was just more curious why. Why do people like rock music? Why do people like dance music? Why don't some people like the other? Why do certain people like to do, I suppose, different hobbies? So for me, it's just more been about why there's individual differences and why do people do things differently and why do they see the world differently. However, as times evolved, the helping component has probably come more to fruition where you see people, especially when they have distress from more mental illness and psychopathology, and you feel that if you've got some set of tools or you can help them or at least, give them some different way of perceiving their concerns, and that's quite fulfilling. So originally it was based on why, and now it's more evolved to be a combination of why and being able to help someone with their symptomology.
At cerebral psychology, what can people expect when seeing a psychologist?
I think the first thing that most psychologists agree on is that they've got a very comfortable place to talk about what's on their mind. And they shouldn't feel like there'll be some form of judgment, stigma. And I try to nurture the fact that they can talk about whatever they want, and I also try to collaboratively give them the ability, if they're not comfortable with what I'm saying or what I'm thinking or some of the things that I suggest, I want them to be upfront and tell me that. So I don't want this type of hierarchy like teacher-student. It's more about we're going to work together collaboratively, maybe like two detectives, to put some pieces of a puzzle together, or the best way we think, and try to work out ways to manage whatever their concerns are.
What's your approach to treatment?
So my approach to treatment would be very similar to most psychologists, that we use different therapeutic techniques to help reduce a person's symptomology. However, there is a little bit of a difference. I do consider that a person's brain does bring a little bit more information to the clinic. In other words, that they may have a long history of being anxious, they may have a long history of being depressed, and this could be somewhat, maybe now from its chronic duration, a little bit inbuilt into the neural pathways of the brain. So my approach is to consider that there's probably been some form of genetic family history that's promoting this type of behavior or cognitions and concerns, and to work with that and to work with other, I suppose, evidence-based treatments that help alleviate that. I think in summary, my approach to treatment is first, I need to understand what the client wants to get out of treatment. So what do they value and what are their goals? Once we can elaborate what they are, we need to be able to measure it. And we need to put things in place so we can see that we're on the right track. So for me, it's about, if they say, I'd just like to see the world just a little bit less negative, that's great. So then what would that look like? What are some of the things that we can do behaviorally, cognitively, even physiologically to try and help with that? And then can we measure it ongoing to see that we're on the right track? And sometimes we might not be on the right track. And how do we revert back, look at the goals, look at the way we're measuring it, and consider other types of therapeutic approaches that may have a benefit to the client. We need to remember that CBT is a generalized way of treating patients. The psychologist's job is like taking ingredients for cooking. We need to tailor it towards our client because there's that individuality, and that person has their own story and their narrative.
What disorders do you like to work with?
So the disorders I like to work with are probably what people would consider the complex ones. So obsessive compulsive disorder. And when I say complex, I mean that they have a higher rate of relapse, or they have a higher rate of where people don't actually go for treatment when the symptoms first appear. So social anxiety disorder and certain forms of eating disorders. Now, the reason why I find them intriguing, and I'll just sit with social anxiety disorder, is that one of the very things that brings us a lot of pleasure in life is our social relationships. So for someone with social anxiety, you can see how they're going to have a little bit more distress than, say, for example, a person with generalized anxiety disorder. That's not to trivialize it and say that a person who has generalized anxiety disorder doesn't have the same amount of distress as someone with social anxiety disorder. What it's just trying to suggest is that we consider social networks as protective factors, and we use that in therapy. When people are fearful of negative evaluation, or they fear that people are judging them, or they fear that they're going to act in a certain way that makes them avoid social situations and the opportunity for positive reward, then that can really be dramatic to their symptomology. And I think we need to remember with social anxiety disorder, if you speak to people with social anxiety disorder, they'll tell you, I avoided that threat, I avoided that situation, I used a safety behavior. But the one thing they don't realize, that there's a flip side to that coin. While they've avoided threats, they've also avoided the opportunity for experiencing the potential of positive reward, forming a new relationship, forming a friend, having a positive experience, having, I suppose, a period of time when they experience positive effect. So I find these disorders intriguing, and based on, goes back to the why, because I find it intriguing, I feel like I'm more suited or motivated to help people with their concerns.
What is your favourite psychologist or researcher?
So we can go back to the late 1800s, 1900s. So Sigmund Freud has had a massive impact on me. And it's funny, you mention his name, and it's kind of like you take a bit of a deep breath because you know that he gets a lot of criticism. And he has said a lot of outlandish things, especially towards the sexuality components of his theories. But there's a lot of things that he's also said that a lot of people aren't even aware of. So I remember in my undergrad, one of our lecturers was talking about him, who's a fan also, and people were so upset about him talking about Sigmund Freud. But the thing is, they probably haven't even read one of his books, or probably don't even really know his theories. So I like his theories because he was a great observer and he asked why. He might not have got it right a lot of the times, but when he did get it right, it made a big difference and a big impact to psychology. So a lot of the things that we do in therapy is based on a lot of Freudian theories. And my prediction is that the unconscious, while was seen as some form of cauldron that repressed inappropriate thoughts from the ego, which was most likely our consciousness, that will probably get rewritten to be something along the lines in neuroscientific literature, is that the unconscious is some of these prepotent types of events that occur outside our awareness that potentially in advance predisposes to certain behaviors. So while it might not be based on defense mechanisms and trauma, there is probably something outside our awareness, just the way we respond to threat with our amygdala. It's a threat detector, not a fear detector. Very wrong when people talk about the amygdala fear. It detects threat, creates this physiological arousal that we're not even conscious of. We become conscious of it, and then we use that top-down type of process to say, why are we scared? And then we feel afraid. So I think in time, some of Freud's theories will be rewritten to some more updated research, but I think he asked some great questions and was a great observer. More current people that I really enjoy reading, David Buss from Evolutionary Psychology, Paul Bloom, Robert Sapolsky. I do like listening to Jordan Peterson. I think he's taken on a little bit more of an opinion piece at the moment. And probably from research point of view, even though David Buss is a prolific researcher, I like Nick Haslam from Melbourne. He's a professor at Melbourne Uni. He writes some interesting things, actually some really interesting things on personality and social psych. Gad Sad, and look, the list is pretty long, but probably another person that had a big impact on me was Jonathan Haidt.
Great.